This is breaking just before airtime on Mondays. The Congressional Budget Office has now found they have scored the Republican bill, the Republican health care bill that came out just last Thursday. And it will result in 22 million more Americans being uninsured in 2026 than they would if President Barack Obama's health care law, the Affordable Care Act, stayed in place. So 22 million Americans will lose their insurance under the Senate Republican scheme, according to the nonpartisan Congressional Budget Office on Monday. In what is seen as a blow to Republican leaders and their hopes of pushing this plan through the chamber this week. They are hurrying to get it out before the 4th of July. But I guess, once again, in redefining good news, hey, this is good news. It only takes away health care from 22 million people, whereas the House version takes health care away from 23 million people. Good news for a million people, right?
Well, there you go. That's about all there is in there.
That's about it. Yeah, it would also save, this is for budget hawks, it would also save $321 billion over the next decade. Save the government that much money. That's got to be good news to people who care about such things, much more than they care about the health of citizens of these United States. Of course, that happens by spending $1 trillion less on health care than what would currently be spent, and using those savings to repeal the Affordable Care Act's taxes to wealthy individuals, a handful of wealthy individuals, and a bunch of medical companies as well. So there's good news. For rich people, you're going to get a whole bunch of money back, billions of dollars back in taxes. Who cares if those poor people suffer and die in the meantime? The CBO coverage estimates pose yet another problem for Senator Mitch McConnell, according to AP. He had hoped to have that vote before the July 4 recess at the end of this week. But even by Friday afternoon, the day after he revealed the legislation, he was already facing public statements of opposition of varying levels from at least 5 GOP senators. He can only afford to lose 2 of them before this bill won't pass with a bare majority in the U.S. Senate. The 22 million additional people without coverage under the Senate proposal is just a hair better than the 23 million people who'd be left without insurance under the measure that the House approved last month, according to AP. Donald Trump has called that version mean and called on Senate Republicans to approve legislation with more heart. Well, this has got more heart. This has got 1 million people more heart. Of course, it is worse for Americans in the immediate future because the House bill, the CBO had found, would lose coverage for 14 million people next year alone. The Senate bill would result in 15 million of them with no insurance next year. So he's facing a lot of opposition, not just from members of his own caucus, of course, but from outside groups. We went through a list last week of the hospital groups and medical groups who had come out against, in no uncertain terms, against this bill. And that is no doubt why the number 2 Senate Republican, John Cornyn of Texas, who had previously said that, maybe we'll vote on this bill later in July after the recess. He tweeted out today, quote, "I am closing the door. We need to do this week before double-digit premium increases are announced for next year."
Oh, like they care.
That's why he's doing it.
Yeah,
not
right.
Because to avoid the increases, not to avoid the growing opposition and people like you calling in to your senator at 202-224-3121 and giving them your opinion on how they should vote. Donald Trump struck what the New York Times called a tone of resignation Monday on Twitter, noting that Republican senators were working hard to pass their repeal bill, but added, "It's not easy. Perhaps just let Obamacare crash and burn," said the President of the United States. Well, that's not mean at all, is it? To the some 20 million Americans who have gained coverage thanks to the Affordable Care Act. So now we're looking at Republican Senators Dean Heller of Nevada, Susan Collins of Maine, several other moderate GOP senators who have expressed concerns about this measure. And the fact that it would increase the number of uninsured people substantially, according to the CBO today. The increase would be disproportionately larger among older people with lower income. Those between the ages of 50 and 64 in particular, with incomes below 200% of the poverty level, they would, at least until this bill, have been covered by Medicaid until they're 65 when Medicare kicks in. But this Senate bill really guts Medicaid on a whole bunch of different levels, as we have been discussing and as we will be once again discussing in the days ahead.
And remember, It delays it until 2021, until after the next presidential election. Yeah. And then that's when the bomb will go off for all these people who may not be aware before they vote for the next president. At
the same time, a bunch of Nobel-winning economists have now come out against the Senate health care bill. This includes there's a group of about 30, I think, 30 economists came out against the bill today, including 6 Nobel Prize winners, expressing opposition to the Senate Republicans' legislation, arguing that it, quote, threatens reduced coverage and higher costs for those who continue to have it. So hospitals are against it. Economists are against it, and today as well, the American Medical Association came out against the bill. In a letter to Senate leaders, they outlined their opposition to the so-called Better Care Reconciliation Act. Throughout the health system reform debate, the AMA has urged that reforms not result in individuals with health insurance losing access to affordable quality coverage. That Medicaid and other safety nets not continue to be adequately funded, and that key market reforms such as pre-existing conditions be maintained. The Senate draft, however, they find violates many of those principles. In their letter to Senate Majority Leader Mitch McConnell and Senate Minority Leader Chuck Schumer, the AMA said, on behalf of the physician and medical student members of the American Medical Association, we are writing to express our opposition to the discussion draft of the Better Care Reconciliation Act, released on June 22nd. The letter begins, medicine has long operated under the precept of first do no harm. This legislation violates that standard on many levels, they go on to say. So does anybody like this bill? Does anybody other than the Republicans in the Senate who are desperately working to pass this thing, does anybody like this bill? And I guess maybe the rich people who have their health insurance and, hey, they're going to get anywhere from $50,000 on up to millions of dollars in tax breaks. And while the cuts to health care, those don't kick in for a couple of years, the tax cuts, those will be retroactive going back to 2016 under the Senate bill, if it ever gets passed.
Because this is actually a tax cut bill dressed up as health care.